Hello friends and welcome to my channel. I am your host Dr. Santosh, ENT and head and neck surgeon. Today we will learn about the premalignant conditions that affect the oral cavity. Most of the premalignant conditions of the oral cavity are caused by smoking and alcohol consumption. The smoking and the alcohol predispose to development of malignancy of the oral cavity and the supraglottis. The tobacco contains a variety of carcinogens like benzoylpyrene, which can cause malignancy. The tar in the tobacco is the most frequent carcinogen, and this tar gets dissolved in alcohol and enhances the carcinogenicity of the smoking. So alcohol and smoking are synergistic. The first premalignant condition we are learning today is called Leukoplakia. Leukoplakia is an area of the oral mucosa that has become keratinized due to irritation from smoking and betel nut. Leukoplakia is premalignant because it represents an area of dysplasia in the mucosa. Leukoplakia represents an area of dysplasia, and the dysplastic keratin, when it becomes wet, appears as white patches. Treatment of leukoplakia is education, stoppage of smoking, and antioxidants like lycopene. In addition, you can remove this area by using a laser. The next lesion we learn today is Ertroplekia. The Ertroplekia is more dysplastic than Leukoplakia and appears as red velvety patch of mucosa. Again, like Leukoplakia, it is seen in smokers and betel nut users and is an area of dysplasia. However, the amount of dysplasia in Ertroplekia is far greater than Leukoplakia. Hence, the chance of development of malignancy is much higher in erythroplakic lesions than with Leukoplakia. Treatment is same as Leukoplakia. Tumors of minor salivary glands are usually malignant. In contrast to tumors of parotid and submandibular gland are usually benign. So minor salivary gland tumors are usually malignant and dangerous. So this picture shows you a small tumor of the minor salivary gland. Wide excision and histopathological confirmation is required. Though trauma itself is not a risk factor for developing malignancy, chronic trauma from sharp tooth along the lateral aspect of the tongue can predispose to development of malignancy due to chronic irritation and is described classically as one of the predisposing factors. This traumatic ulcer on the lateral aspect of the tongue will heal if the sharp tooth is removed or it is filed off. Syphilis has been described as the great mimic because it mimics so many diseases. Thankfully, syphilis is almost eradicated. This is a rare picture of secondary syphilis of the oral cavity showing snail track ulcers. So you see various lines that are like tracks of a snail. Syphilitic ulcers of the oral cavity are also a risk factor for development of oral malignancy. Finally, all premalignant lesions, if untreated, will finally lead to invasive squamous cell carcinoma of the oral cavity. Here you can see an infiltrative lesion of the central part of the tongue, and edges are irregular and slough is present. This represents in all possibility an infiltrative squamous cell carcinoma of the tongue.